Hello and welcome to the Learned It, Living It podcast. Today I am delighted to be hosting a special episode as part of T-Levels Week, and I have around me 4 students and 1 tutor. So welcome everybody. How are we doing? Good, yeah, fantastic. So we're going to get straight into it. I've only just met you briefly before we started, so I'm really interested to learn more about the T-level health qualifications that you are doing. So would you introduce yourself, please?
I'm Kyla Small.
Kylie Small, yeah, nice to meet you.
I'm Izzy Coulson.
Izzy Coulson.
I'm Madison Longstaff-Jones.
Madison Longstaff-Jones. Charlie Otherton. And Jordan.
I'm Sarah Lloyd.
And are you the tutor?
I'm a tutor
the
for
leader.
T-level health, yeah.
T-level health, fantastic. Well, delighted to have you on, and I'm really keen to learn more. I've seen lots of stuff going on in the college around health, but I've never actually had much chance to kind of get involved and learn more about it. So today is going to be a great experience for me. So first up, from one of you students over there, looking fantastic, why choose T-level health over any of the other routes that you could have done at college?
It's more hands-on, we do more practical stuff. We put it into theory and then we do it in the ward in practice.
Okay, so for my benefit, because I did A-levels and that a few years ago, just a couple of years ago now, but obviously with the T-level, they didn't exist when I was around. So is a T-level a more practical qualification? Yeah.
It's a technical qualification.
Oh, T for technical, there we go. I've learned something today, so there we go. So apologies, I always wondered why they called it a T-level. So T for technical, and basically you're very hands-on and you do lots of learning on the course. What sort of things do you cover in the course?
So obviously first aid, safeguarding, all the legislation and stuff like that. And then we've also got like industry placements. So 4 of us have NHS placements and then others are just in care homes and that.
Wow, okay. So is it the 4 of you that have got placements
No.
at NHS?
It's me and Charlie.
Yeah, so where's your placement?
We're not sure yet, but it's in a hospital.
All right, fantastic. So you really get to go
Yeah,
to the...
so we've had to have like loads of vaccines and blood tests and that.
How's that been?
Wonderful.
It's okay, you can be absolutely honest. We're all about honesty on this. But yeah, so has it been, like, obviously, you've immediately said legislation. You've immediately said we've had to be vaccinated and all sorts of things. And when did you start in September just gone by?
Yeah.
Yeah.
Start the course in September, but the placements might be in like January, December time.
Okay, so you get like a few months in the classroom and then you get to take it into a real world placement. How's that experience been then? Because obviously you've gone from starting the course to getting vaccinated, learning legislation. Sounds quite serious and there's a lot. You love it?
Yeah, because it's just, like I said, we learn stuff and then we're going to end up putting all that into the placement. So it's working really well, I think.
Absolutely. Where are your placements? Do you know yet?
Care home.
Care home? Yeah.
In our towns where we live.
In your towns where you live. So where are your towns where you live?
Shildon.
Shildon?
Newton Aycliffe.
And Newton Aycliffe. Brilliant. So you get to work in the local area and work back with that. Is that the first time you'll have worked in one of those environments?
Yeah, we go in like December time. So.
Wow. Okay, no hanging around, so literally straight in the door. That's fantastic. I mean, for me, you know, how does a traditional sort of T-level course differ from an A-level course? What sort of knowledge and skills are they gaining differently?
So T-level is more hands-on. A-level is more academic. It's kind of getting ready for exams, passing the exams. There's not really much practical side of it. With T-levels, it's more practical. So what I do try and do every unit we teach, some of them aren't as interesting as others, but we do try and link it to the care settings. And we'll do a lot in the ward alongside, obviously, what we're teaching. I know they've done bed bathing already with one of the other tutors, and we'll go through what they'll need to know when they're ready for placements when they go in January. So it's just more practical. We're doing more hands-on stuff, getting ready for the actual life experience or getting experience for when they go into the placements.
Wow, straight in there. I love the format of the course. I think it's brilliant because it really does get you prepared to go straight in. So I imagine that your starting position going into a placement, I imagine it's a lot higher position of knowledge in terms of working with people.
So we do try and kind of get them ready and go through like things what might happen, what to expect. Obviously, care homes and hospitals are completely different. But we do try and get the learners ready for placements, so when they go in, it's not so much of a shock for them when they actually enter the care homes, because a lot of them have never been in them settings before. They might have been to hospital for appointments, but they've never actually been working in them environments before, so it's just to get them prepared for that before they go in January.
Absolutely. So you've had a few months now. So do you think you're starting to feel prepared, ready to go into?
Yeah.
Yeah. If I asked you the same question in August, would you feel prepared to go in at that point, or do you feel what you've done over the last few months is really setting you in good stead to take it on? What's been sort of the biggest surprises for you, for example, when you've been doing the courses and learning? What are the things that you didn't anticipate that you were going to have to do?
Like, I don't know, like the practical elements. I thought we'd look like, because we've got mannequin dolls.
Yes.
I just thought we'd be speaking to them, but then we're doing like cannulas, and we'll be doing like suturing and that soon. So I didn't expect it to be that practical.
Already done cannulas?
No, we're going to
Or are you
be
working?
doing that this month, aren't we?
Yeah.
Wow. Yeah. I mean, that's quite serious quite quickly, isn't it, in terms of course?
Yeah.
Which I think is great, because it really gets you straight into what you're there to do, I suppose, at the end of the day. What would be, so obviously we touched on the cannulas and stuff. What sort of other practical elements have you done so far on the courses? What examples have you got?
We do blood pressures on each other quite often.
Yeah, and how are the blood pressures sitting? Stress levels high or low at the moment?
No, actually.
They're all right.
Right.
Stress level, that's good. You can monitor that as you go on.
It's quite a good group of people in our course, so it's not a stressful environment.
There's only 9 of us.
Yeah.
And we all get along quite well.
Yeah.
I'll take each other's blood pressure to see how you're faring
Yeah.
on a particular day. I love that. That's brilliant. What other sort of practical elements have you had the chance to do so far?
Obviously, we did like the first aid, so CPR, recovery position, just general stuff like that. Basically, if you're a first responder, you're first one on scene, that's the sort of stuff you need to do, basically.
Took the mannequins on a walk in the wheelchair, didn't we?
I know you did, because I was actually in a meeting with Simon, who sat over there, and as I looked out the window, I think it was you four going past with a mannequin. I was like, first of all, I thought you had somebody in the chair, because they're so lifelike. And is that
I think I might have had Poppy in there, actually.
And there was one with Poppy and there was one with mannequin. It
There's-
was an older lady, it was the mannequin.
It was the older lady.
Boris.
Yeah,
Bless
I was
her.
like, where are those students taking that lady? And then I realised it was a mannequin. So yeah, I've had the pleasure of meeting those mannequins, and one was sat behind the door, and it didn't half give me a bit of a jump in the office. That someone had left it behind the door. So when I shut the door in the office, it scared me, to be honest. It was like someone was waiting for me. But there's a few different mannequins that you've got on the course. What sort of mannequins have you got?
We've got Doris. She represents obviously like an old lady,
Mm-hmm.
and then we've got a teenager. What's Bertha representing?
Bertha.
40% of the American population who has obesity.
Yeah.
Right.
So
okay.
she's like quite big,
Yeah.
and then we've got Alex. He's like AI.
I've met Alex briefly. How is Alex?
He's good. He's good at teaching students how to take patient histories, having a conversation about asking about his ailments, what's wrong with him, why he's coming today. He's not always 100% at his answers, but as long as the room's quiet and we can just have a proper conversation, he works pretty well, doesn't he? It's breaking the ice between the students and Alex, because a lot of them are a bit nervous about speaking to him to start off with. But actually when they get through that, they do quite well. Ask him lots of questions.
Yeah, I suppose that's a... is there a part on the course where you've had to actually go how to speak with someone, develop the skills? Because it's very easy to focus on, say, cannulas and doing that sort of stuff, but actually dealing with people is such a huge
Yeah, we've
amount.
had to do like loads of presentations, which is basically building our communication skills. And obviously the first presentation was quite scary, but now we actually feel more comfortable doing it. So therefore we feel more comfortable actually putting it into practice.
No, that's brilliant. So do you put a lot into the place to... Because I suppose one thing's doing the treatments or the procedures or whichever, but I suppose people skills in healthcare, it's one of the most important skills, isn't it?
Yeah, so what I normally do every year with my students is we open up the healthcare ward now, because we've got it this year, to members of staff, and they'll come and get the blood pressure taken.
Right.
The students will do that. Obviously, we do tell the staff that they're not medical professionals. If there is something wrong with blood pressure, they do need to get a doctor's appointment. But it gives them the opportunity to speak to other people as well, not just a friend. So when they're taking blood pressure, they speak to like the principal, will come down, other members of staff will come across. And it's building their confidence to speak to a range of people, not just their friends when they're doing blood pressures, which is really good. So when they do get into practice, they'll feel a bit more confident to speak to the residents or the service users when doing the placement.
Yeah, absolutely. And sometimes I imagine when you're sat there doing someone's blood pressure, could be a deadly silence, and you kind of need to make some small talk, don't you, to make them feel... Because that's really important, to make the person feel at ease.
Yeah, more comfortable.
Exactly. So I think that's brilliant, and I love the fact that you're incorporating the mannequins. Alex, tell me a bit more about Alex the mannequin. Is it an AI?
He's an AI mannequin. You program him with what you want to have wrong with him. So you could have a chest complaint, you could have nothing wrong with him at all. You could have angina. There's loads of things you could program into him, and you'll put his blood pressure on there, his rest rates, that sort of stuff. You could either talk. He can talk himself, or if you want to sit in another room, you can talk through him. So you can give the students things. You can tell the students things through Alex, if you want to do it that way.
Yeah.
Or they could just talk and ask him questions.
He records as well through his eyes as well.
He records through his eyes.
Yeah.
Okay.
To measure our progress, basically.
Yeah. What's that been like? Have you reviewed that footage? Have you seen that
Not
footage
yet.
at all? Not yet.
No, but we've used him.
Yeah, again, briefly met Alex. I haven't had a chance to treat him for anything, but it sounds like a fantastic element. I suppose for me, what has been the most challenging bit you've had so far? I know you've got the placements, and that's going to bring up a new set of challenges dealing with real world people. But in terms of your experience,
Doing that first presentation, that was pretty scary.
first presentation,
Yeah.
I think it's like as well with the course we do science, so it's getting our head round like science as well, because it's completely different to GCSE.
So you've got to kind of understand the theory, and then obviously deal with it. But you can't just recite a textbook to a person. You need to bring in the people skills as you go. I suppose for me, obviously with yourself working with the students and seeing them develop, what are the biggest benefits that you see when the students go on to work placement? What do you imagine these guys will be facing?
I think it's the confidence it builds in them, and knowing that actually it's not as scary as it may seem when they come out of school. And they enjoy it. It's that whole practical element of the course. That's why they've chosen T level, to get that practical element. Whereas if they chose A level, the practical could be there if they volunteered for further roles. But actually, for the T level, it's part of the course, so they have to do the placement. They have to get the experience. Which then, if they go off to university, looks good for them because they've had that experience prior to going to university. But it's nice to see them develop as students as well.
Yeah.
And get that.
I think the placement's really good from the college point of view in terms of the live it element. It's like being able to actually live the course in this case and put things through. And I think it's fantastic. And it'd be good to catch up with you actually and find out how the placements go in the future. So what I want to do is just double back to each one of you and kind of get why did you choose health? Why health? So could we start with yourself? Why go down the health route?
I've always wanted to do something from like being younger, like in the health, because like most of my family, like my mum was a medic in the army, and then like my great nana, she was like obviously a nurse. So I think I've always wanted to do it. And then we came for like taster days in school, and I think I picked like health and social and childcare, and obviously they mentioned that there was a ward. And then from then, all the open days I was there, and obviously speaking to Sarah, and then just from then.
I love how you kept it like it's a nice family tradition.
I feel like with my GCSEs, I struggled a bit in school, so like once I found what I wanted to do in college, it kind of pushed me a bit further, and then I got my GCSEs and I managed to get on the course I wanted to do.
Yes, congratulations on that. I think part of the challenge is recognising what you want to do, and then you've got that focus and you've gone for it, so it's brilliant. What about yourself? Why did you want to go down the health route?
Well, I didn't pick health at first. I did hairdressing last year.
Mm-hmm.
And then my mum had a baby in May, and it didn't go in March, and it didn't go great, but I sort of thought, what can I do then? So when it came to switching courses, I knew I wasn't going back to hairdressing because I just didn't enjoy it.
Mm-hmm.
And I went to the college, and I didn't know T-level was a thing, did I? It was you who told me. So I applied for the level 2 healthcare course, and Sarah was like, you've got good results. So
To go for healthcare.
yeah.
And you obviously inspired out of your mum having a baby.
Experience, yeah.
I think that's incredible.
Yeah.
Well, good on you for looking at the options, and obviously it's great that you found the T level, learned a bit more about it, and now you're pursuing that path. What made you choose healthcare?
It's just always something that I wanted to do, and like Kyla, my family's always been in healthcare,
Right. Yeah.
so I've been around it a lot.
Yeah.
And then with the T level, I'm more of a practical learner.
Okay.
I can't really do stuff academically, so I like it more.
So you thought that the T-level would be suitable to the way you learn and the way you want to do it. And has that met your expectations so far? Yeah. That's brilliant. And why did you go down the route of healthcare?
I've had like 10 operations, and I've been in the back of an ambulance loads, and I kind of want to be in the front as a paramedic, and I want to give back. Basically, I want to give back. I want to help people.
Fantastic. Oh, I love that. It's interesting. Why did you get into healthcare? There's a good question.
You were a medic in the army, weren't you, Sarah?
Yes, I joined the army. I signed on at 15. I really wanted to be a vet before I joined the army, and then I went shopping, and I went past the careers centre, and it looked really, really interesting. And I went in and spoke to some people in the careers centre, and they kind of gave me the idea of being a medic in the army. I would have thought of being a paramedic when I left. I did 13 years as an army medic. I had children, and at that stage I was like, actually, this isn't for me anymore. And then my manager now saw me, said, have you ever thought about teaching? Teaching in healthcare? And I was like, absolutely never crossed my mind. And then that was 8 years ago. Nice. And I've worked at Downton College since, teaching healthcare, and I like it. It's good. It's very challenging at times, but when you see what comes out at the end of the year compared to what you got at the start of the year, it's nice to see that development of learners. For maybe sometimes you get really immature learners in September. By the time they leave in June, you feel like actually they're ready to move on and progress, and it's nice to see that development of that. And those who come at level 1 and go all the way through and get to university, it's nice to see that development as well.
There you go. Did you know that story?
Yeah.
Oh, well, brilliant. Good on you for sharing it. And I think it's interesting to see what brings people to do it, though. It's really interesting. But like you say, in terms of, healthcare, it's a serious subject at the end of the day. And obviously you come in at September, you've gone from, say, your school to college, if you're going straight in there. Obviously the subject matter is serious. You're taking care of people, there's position of responsibility, and there's all those things there that you've got to kind of learn on the fly really quickly. I think for me, what do you think the benefits of the placement are going to be for yourself?
Putting obviously what we learn about in college into practice, and to be fair, when I've always been to appointments, like I just want to be the one like doing stuff and that. But yeah, I think it'll just learn us a bit more.
Yeah, just go with an open mind and see what it goes. Has anyone else got a different thing that they think that they'll?
Just the transferable skills from it, the life experience. You can't replace that, and then you can take that on to whatever you want to do, basically.
Yeah. And what about yourself?
It's an experience you don't get the traditional education route. So, say if you do A levels, you don't get the workplace experience, and you don't get to put it on your CV. You don't get to go and tell university, oh well, I've done this in college. So it gives you a boost, doesn't it, just in life, being able to say, well, I've done this, and this is the experience I've got.
Yeah, I suppose coming back to your point of being in and around the busyness, even just being in that environment is such a good experience. And whilst it's not, necessarily learning legislation or learning this, it's so important to learn how these places work and operate. And it's kind of, I suppose, unwritten skills in some regard that they're reliant on.
With the placements, I think it's more like you're more proud of yourself, because obviously it was an interview. All 9 of us had to have an interview, and obviously there was only 4 of us, being chosen. It was nice.
It's a competitive process to go through as well. How did you find that?
It was a bit stressful because obviously that was literally my only interview, and it being something so big. But luckily it wasn't formal. It was very informal, and it was good.
Do you feel like that would prepare you for, let's say, when you finish college? How long is your course? How long?
2 years.
So finish in 2026.
Okay. Finish in 2026. So imagine you get to the end of that. Do you feel that will help you going forward and actually applying for jobs and having to go? Yeah. I suppose it's a big transition from education to workplace in terms of getting, one thing is getting the piece of paper, your certificate, but the next thing is trying to get yourself that job. And it sounds like it'll set you in good stead. I suppose, for you, what do you think are the key things? You're going to let these students go is it January?
Yes.
Yeah, so they're going to go off to their placements in January. What do you think the biggest changes are you're going to see from the start of the placement to the end of the placement in the students?
It'll be the confidence, what it brings out in them, and the communication skills, the kind of soft people skills, what they need to learn for life, really. So communicating with different people, being able to handle different situations. They won't actually be, they won't be left on their own for any reason on placement. They'll always be shadowed by someone, or always shadowing someone, should I say. So they'll be able to develop them skills, but in a safe environment, so they're not left on their own. And nothing really could go wrong because they've always got someone to shadow, someone to be with. So it helps them build them soft skills, nice people skills, and they'll probably get a chance to do some hands-on stuff as well. In terms of, could be all sorts of things, depending on where you're in placement, really. And depending on the ages, so some of the placements depend on the age. So Izzy's slightly older than the other learners, she'll get more opportunity in placement because she's over the age of 18, whereas under 18s are very protected because of their age. Over 18s get a bit more opportunity if they want to take that opportunity to do some more personal care type things, if that's what she wants to do.
Brilliant. Oh, well, I'm really excited to see how those pan out. I think for me, what would be good to understand is when you're coming, so you've finished school in the summer, when you're looking at different options, if we start with yourself, did you look at the different career paths? Well, how did you land on T-level? Like, did you look at the different courses? What were you looking at?
Obviously, going back to like before, when I came to look around the college, like that's the only thing I wanted to do. And like you can go, I think it's equivalent to 3 A-levels, isn't it? So obviously with that, with like the UCAS points, I can go to university, and then from that I can go and do like my nursing or my midwifery.
So you looked at the pathway right the way through to career. And yes, you've got some flexibility, which is great, but you've got your general direction. You went for it and you thought T-level being equivalent to 3 A-levels was brilliant. What about yourself? Obviously, you had to change. Was that a discussion with yourself?
Yeah.
Was it?
Yeah. I didn't know anything.
Yeah.
I knew I wanted to do health, so I went in health, sat down, I had it all explained to me. I don't know.
It's your job to explain it. Yeah. So obviously presented with, I'm interested in health, and did you provide the different?
Yeah. So at the moment we're running 2 different healthcare courses: the level 3 certificate in health and social care, and that's the same sort of course, but it's more assignment based. So we do 9 different assignments in the first year and the second year. So I sat with Izzy and spoke to her about that course, which is more assignment based. It does have the placement element, or the T level, which is more hands on and practical, but it's exam based. So it's going through that conversation with the students and what they want, what they'll do better on. And for Izzy, it was a placement element, and the more hands on, we'll be in the ward more. So we'll do a lot more of the work around the ward. There's still a lot of academic work to do. We do have a lot of learning to do, don't we? But when we get the chance, like at least once or twice a week, we do try and get something in. And they do practical with science as well. So that breaks up the...
We do practical in science nearly like every lesson.
Yeah, so what sort of practical in science are you
So
doing?
recently we've been like making bacteria.
Okay, I
Like,
didn't expect you to say that. Making bacteria.
Yeah, just with like things like around you, like what did we do? Tables, toilet doors. Obviously they go in like a glass, what is it? Petri dish, and then they go in like an incubator and
what? So why were you doing that experiment? Like, why were you doing that
To
practical?
show the pathogens that caused it, basically the bacterium that caused it.
So we were doing about like pathogens and viruses and infection and that.
It makes us aware of what causes us harm in our daily lives, and the importance of keeping ourselves and the things around us clean.
Did it change your perspective on it, and in terms of going around the world? And
I scrubbed my phone off.
you scrubbed your phone? Yeah, absolutely. My wife works in the NHS, and I'm very aware of the amount of hand cleaning, washing she has to do on a daily basis. So, it's quite alarming, isn't it, when you see what's out there? So, do you now all sing "Happy Birthday" when you're at the sink washing your hands? That was my children still remember that from lockdown. It's funny how the little things. Yeah, definitely. Yeah, catch one of them every now and then singing "Happy Birthday" and sing. I'm like, you can sing it in your head, that sort of thing. So yeah, it's alarming. What other sort of science stuff have you done then?
Microscopes. Okay.
Yeah, so having a look through the microscope.
Onion layers, so we can see the different cells in the layers.
And then we're doing like the starch and like the potatoes.
Yeah, proteins, enzymes.
We did something the other day, and it was like, what was it? It was like jelly.
Agar jelly. It was just the colour change of it, basically, about the bacteria in it, I think.
Yeah.
So if you put vinegar on it, it goes clear, basically.
Okay, so vinegar did the job. Is that what you're telling
Yeah.
me? Yeah, basically. Okay, so you lose. Yeah, because obviously pandemic was a few years ago now, but obviously we've kind of put hand hygiene on a lot of people's radar that maybe weren't adhering to hand hygiene before, and you certainly learn things. So I imagine seeing it firsthand, but in a healthcare setting, it's so important to get that infection control correct, and you're safeguarding other people ultimately. So I think the fact that you get to see it in a way like that, you're going to remember that, aren't you? In terms of you're going to remember what that bacteria looks like and how it grows and spreads. Did you say toilet door?
Yeah.
How was that?
Not great.
Not great.
To be fair, a couple people's phones on the table were worse. It was.
Oh, were you
was
looking at each
really-
other's phones?
Yeah,
that we saw.
yeah, the stools. It was really interesting, to see.
The tabletop, sorry.
Yeah, that the things in the classroom had more bacteria than things in the bathroom.
Yeah.
It was weird.
But then do you have to kind of recalibrate and learn what's a healthy level
Yeah.
to do? Obviously, you can't have zero, but there's going to be bacteria somewhere along the lines. But obviously, making sure that you're doing the right things is absolutely fantastic. So, I suppose question for you: how do you see the future of T levels supporting the healthcare sector?
The T levels are developed with the organisations such as the NHS. So what we now teach on T level is what the organisations have asked for. So the units have changed from the generic course we did up until this year, and the units are much better. They are more informative, and it is related to the healthcare world now rather than before. Some of the stuff we taught, we teach it well, but it's not very useful in the NHS world, whereas now the T levels have worked alongside the NHS to develop the T level, and all the units kind of interlinked to healthcare now in today's day and age. And I think it's a lot more useful for the students and for us as teachers to obviously keep on top of that and obviously keep with the times.
Yeah, I think the fact anywhere where industry is informing the education, I think that's great. So T levels had liaison with the NHS basically.
It's not just NHS. There's quite a few healthcare companies or healthcare organisations involved in it. But they all talk amongst themselves. That's what developed T levels quite a few years ago now, and we've just brought it in this year as down to college. We started off with childcare. We're now doing healthcare. We've added it this year.
Okay, well, it sounds brilliant. It sounds like it's paying off, obviously, with the infection control example right there. I mean, if that isn't going to get the message through, I don't know what would at the end of the day. So that's brilliant. And what do you see, obviously, with the placements in terms of what they're doing? Obviously, I imagine you're going to get a student that's more ready for the workplace at the end of the course?
Yes, definitely. So obviously part of T-levels, they do have, specifically in the second year, they have skills they have to pass for the second year, and they get observed on them and they get tested on the skills. It's not like cannulation. We don't test on that. It's things like personal care, communication, the sort of soft skills they'll learn to go out as a healthcare assistant rather than a nurse.
Yep.
Because the nursing sort of qualification comes from university. We just get them ready to be able to assist in them processes. So they're ready to go out the door, get jobs as healthcare assistants.
Yeah, but it gives you that great start point for a nurse.
So a great starting point to go to university, and you've already had kind of hands on some of the equipment that they'll use when they get to university as well, so it's not so daunting for them.
Yeah, is anyone considering university in nursing? I know you touched on midwifery and nursing. Anyone else?
TSET uni for the paramedic apprenticeship.
Paramedic? Oh, the paramedic apprenticeships, yeah. Right, okay. And what about yourselves? What are you thinking?
Newcastle Uni for children's nursing.
Children's nursing. What about yourself?
I'm not sure what I want to do yet.
That's okay, you don't need...
Decided.
Yeah, I think what's good about the T-levels is you'll get some experience, obviously, in there, and you can sort of make an informed decision. Obviously, you've picked healthcare, and then what's nice is you can focus down and work. Like, you've got a couple of options there. I think that's brilliant. And, you're looking at the apprenticeship. So, obviously, T-level sets them in a good stead to take that next step. Fantastic. So, if someone was considering a T-level in healthcare, what would you say to them?
Just do it.
Do it.
Do it. And why?
It's so enjoyable, and again, the transferable skills, you can't replace them. There's nothing better, to be honest. And then it's better than other academic courses. I prefer it.
You do this one, but it's better than the rest. Yeah, obviously favouritism going on there, but yeah, no, that's great. So you learn some really good transferable skills. Obviously, you're going to pick up more on your placement. What about yourself? Why would you say to someone joining the T-level?
Again, just because it's like practical, and like a lot of people learn more practically than just like theory and writing.
Okay, so on that, what I want to ask is, obviously these placements that are happening, do the employers volunteer to be involved? How does it work?
The NHS have done really well. They have. They've put their placements forward to us. The placements are really hard to come by, especially for the T-levels. We do have a really good assessor team in the college, and they approach all the kind of the healthcare centres, to go around all the care homes and nursing homes to ask if we could use them for placements. And we do have a really, really big kind of cohort of placements we could use because the assessors have found them, but it would be brilliant if we get more hospital placements in there for the T-levels. At the moment it's not possible because obviously if you think about the universities also use them hospitals for placements, so we kind of have to have that struggle with, and we understand obviously the universities have priority because they need it for nursing and whatnot, but it'd be nice if there was more space for the T-levels to get in there.
Yeah, but essentially if someone's working in the care home, they can speak to the college and go, yes, we're interested in hosting placements.
Yeah, they absolutely could.
Okay, that's really good to know. I think, I mean, what are the benefits to the employer of doing that? I kind of know the answer because I've Alina over there. I say this on nearly every episode, but Alina's done the apprenticeship at the college. She finished in December last year and she now works here full time. I mean, the college obviously support the employer to host the placement and do that. Do you think potentially they could be looking at the workforce in the future?
Yeah, potentially. So in the past, we've had learners that will go off to get jobs at the placements they've had placements at. At the place they've had placements at, they've gone on to get summer jobs or kind of bank work jobs. It doesn't work for all the students, but a lot of them do enjoy it. The employees enjoy having them to gain that experience, having a fresh set of hands on.
Yeah, I mean, I know the importance of bank staff, obviously, when you've got people on holiday or sickness or anything else, so it's really handy to have that. So there's a good opportunity for you to keep that in your back pocket as you go towards the summer holidays next year, and you might be able to get some work opportunity, who knows. Obviously, we've touched on a couple of the different career paths available to students. I suppose more the courses and training. What sort of things could the students do with a T-level in health? So they can do nursing, midwifery?
Sort of most medical professions, they obviously can't be a doctor through T-level health. They have to go do extra courses for that. But things like midwifery, nursing, paramedic sciences, they go into the physiotherapy routes if they want to. They get the UCAS points built up. If they decide that they want to go to university and they don't want to do healthcare anymore, which is absolutely fine, students change their mind all the time. Within their personal statement, they'll say why they've got the UCAS points from health, and obviously change it to whatever route they want to go down at university, because they'll still have the GCSEs results as well. So they can go down many routes with a good personal statement to say why they want to do that. Because within health, we don't just learn about health, we learn about communication, safeguarding. There's lots of things what can go into different areas of work, really.
Yeah, it's quite holistic by the sounds of it in terms of what people offering. I think for yourselves, obviously, what technology have you come into contact with? Obviously, we've touched on Alex, the AI dummy. What other sort of things have we been doing? Blood pressure monitoring. What about computer systems, record keeping? Have you had to deal with any of this yet?
Not yet.
No. So, but I know later in the year we're going to be doing like ECGs and stuff like that, so I don't know if that counts. But
Yeah, it does, absolutely. So tell me what an ECG, what do you know about ECG? Obviously, you haven't done it yet.
It basically like measures about the heart and stuff.
Yep. So you put sensors on the chest,
you put sensors
as an example.
everywhere basically.
Yeah. There we go, yeah.
That just measures, make sure it goes in the right order.
Make sure the heart's beating correctly. Yeah, absolutely. So obviously, I think it's very clear that they're going to get access to a lot of the different stuff. So when you go to your placement, a lot of the things you will hopefully have already seen by the time you go there, or when you go to university, you'll have already seen this. I suppose for one question I've got here is, what's the difference between T-level in health and a traditional apprenticeship?
Apprenticeships, obviously, they get paid on the job.
Yeah.
To do apprenticeship. It doesn't work for all learners. Obviously, 16 to 18-year-olds, this route is quicker. It gets the UCAS points for university. Apprenticeships don't often hold UCAS points. It does take longer to do. They do get free 3 years education as well, so it's worthwhile as a 16-year-old to come and do the free 3 years education while they have it, if they're not looking at gaining the money from it. So obviously they do get money from apprenticeships, but it depends what they want.
Yeah, it depends what that future career move is. Obviously, if university's on the cards for, say, nursing,
it's definitely more.
You'd want to go down the T-level route.
Yeah, so we do try and push maybe for some, like Charlie was interested in the paramedic apprenticeships, they come in at level 4 level. So it's something they could do after this course if that's what they really want to go down instead of doing the traditional university route.
Yep, okay. I suppose quickly, I know you touched on the paramedic, so you're looking to be a paramedic ultimately? Yeah. What attracts you to that job?
I want to help people.
Yeah, want to help people?
Yeah. I want to be in the front of an ambulance instead of the back of it.
Yeah, that sounds good.
Again, I have family members like Kyla in the service, and I just want to be like them, kind of thing. So, yeah.
Absolutely. And obviously, to yourself, you're making a decision on where you'd like to go next. But what sort of aspirational? What's the driver behind it? Wanting to help people, or?
Yeah, I just want to be in healthcare, really.
Work in healthcare.
Well, I'm not sure which bit yet.
That's all right. There's so many areas in healthcare that you can work in. There's loads to choose on, so that's fantastic. And then obviously you've got the inspiration of your mother and the backstory. So, what's the main drive? Where do you see yourself? If I say 10 years' time, I pick up the phone and say, what are you up to now? Where do you think that might be? It doesn't mean it was where you will be.
Hopefully neonatal nursing.
Neonatal nursing.
Yeah.
Wow.
Premature babies.
Yeah. That'd make such a difference, wouldn't it, to people's lives? Yeah, I think that's very admirable. And what about yourself? Which area in particular? Obviously, you had two, didn't you? Midwifery and nursing.
I was going to do my nursing and then do my midwifery.
Yeah.
Because I don't want to just do midwifery because, as I get older, I might want to just switch back to nursing. But I think, 10 years' time, maybe nurse.
Yeah?
Yeah.
Fantastic. I love it. It's great. It's great to hear. And I think, who knows, may ring in 10 years' time you're doing something in healthcare just completely different. You never know what's around the corner, and I think keep your options open in terms of what you're doing. I suppose, really, how new is the T-level to healthcare in terms of the healthcare training and this and the other? It's the last few years, has it come into play?
Yeah, 4 years, I believe. And I think it's 4 years we've been running T-levels, but Darlington College have only picked up on it this year. We've started running it. We kind of brought the T-levels in slowly. Area by area, really. So healthcare's one of the ones what we picked for this year to run.
And how do you envisage sort of the T-level serving its place, providing people in the workforce? Like, what's the difference?
I think it's more structured for the workforce. The students will be more ready and prepared for going to university, going into the workforce as well from what they learn on the course itself. With the science aspect as well, as much as students do struggle, it is more beneficial for them because obviously part of learning about health is learning about how the body works and why things go wrong and like what it all links to. So I think as a whole the T-level is better because things you cover prepares the students a lot more for the more to work, really, no matter what kind of route you decide to go down.
Yeah. Okay. So obviously you got your placement coming up in the new year. We're recording this 2024 side of Christmas, just so people know point of reference for where we're talking at currently. But what would the students then experience for the rest of the year? So post that placement, how long's the placement, and then
placement goes on all year. So they'll be in placement when they go in. They'll be there every week. Some of the learners will be doing twice a week, depending on what placement they're at. And that'll go through all the way to the summer holidays. They do have 2 exams. So in June, they have an exam on the 12th of June, and that's for science, and they have an exam on the 19th of June for healthcare, which covers everything they've learned in the first year. They also have an employee set project in May, which goes on for 2 weeks, and there's 6 different tasks within the employee set project.
So does the employer set?
They say employee set project, but it's kind of set up around what the employer would like. So it's there's 6 different tasks what they have to complete within that. And it is things like researching a condition, then doing a care plan for a learner, and there's lots of different aspects of that what they have to do. And that goes on for 2 weeks, but they have they'll go in once a day, do the task for that day, and that'll be them revising or doing whatever they need to do for the exam.
Yep.
and then they finish around June 20th. They finish for the summer, and they'll be back in September, but they'll start back in placement straight away in September for the
Yeah,
second
so would
year.
that be the same placement that they've been working at, or a different?
We're not sure yet how we're going to run it, whether the NHS students go back to the NHS or whether we're going to turn that around a bit and let the other learners in and take them out and do a bit of care home work. And they find it best from both ends of the spectrum, really. They do a bit of NHS doctoring, hospital nurse working, and also care home, caring for their elderly work. So it's better for learners to get them two perspectives from.
Yeah, so then obviously that placement will then run September for the full academic year?
Yeah, they finish again in June, and then that's hopefully when they've all, by that point, applied for university. Nobody going in September, and plan that on from the second year.
Sounds like a great course, really does. So obviously you've got all that going on. If that isn't enough, you talked about applying for university.
Yeah.
How are the college supporting the students as they go through that process then?
So from probably December time, we will start looking at UCAS and how UCAS works for the learners. From the following January, we'll start applying for placements for universities for them. We'll go trips to different universities, see what they prefer. One of the students wanted to go down to Loughborough, and I said it's a bit too far, but we will do the local... Katie. We'll do the local universities, but we can't go far. To give them a bit of an idea, because some have never been up to Northumbria University, some have never been to Newcastle, but we'll go around the local and see where we can, what they like, what they don't like. Some students just want to stay local, so they'll just go to Teesside, which is good for them. It's what they prefer, really, but it's opening their eyes to what is actually available. So they've got an idea where they want to go.
And are you guys going to continue talking to, obviously, the college to make sure that you can help facilitate those places for you? Because that's obviously sounds... I know for a fact the college offers such good support for the students. So all I'd say is to any student that ever listens to this, make sure you make use of those services that are available. You've got tutors, support staff. You've got loads of people in the background that are essentially your champions to try and help you get you to that next step. That's brilliant. Well, I've really enjoyed that today. Thank you so much for taking the time and coming in. I really appreciate you telling me a bit more about T-level in health. I think I've certainly learned a lot more. And I think, key things are it's worth, was it 3 A levels?
Yeah.
So T-level's worth 3 A levels, stands for, you can see it as like a technical A level, prepares you for the world of work. And actually, it sounds to me like such a good option, especially for something like healthcare, when you're going to go into placements and then you're leaving college with already experience of being in real healthcare settings that's been facilitated, obviously, by the college, and it's part of the course, and I think that's absolutely fantastic. And I do wish you all the best of luck with your placements coming up, and potentially I'm looking at Simon, we'll be able to get them back on to see how those placements go. I'm talking slightly off mic, so please forgive me. He is nodding his head in the corner there. But no, thank you so much for joining us and sharing the information. If you do want to know anything else about the courses at Darlington College, such as the T-level in healthcare, please visit darlington.ac.uk. And if you just want to get in touch with someone, use the contact information on the website. Feel free to pick up the phone, drop in an email. Someone will happily talk to you about the various options that the college has available. It's not a one-size-fits-all, and as you've heard, we've got lots of options available at the college. So please visit darlington.ac.uk if you want to know more information. Other than that, thank you so much for joining me today, guys. It's been an absolute privilege and pleasure, and we wish you all the best in your continued studies, and hopefully we will catch you some point next year.
Thank you.
Thank you.